Today's lecture is Introduction to Medical Assisting. Responsibilities of the medical assistant are varied. You are the patient navigator. You help the patient navigate the complex healthcare world, from making an appointment, being taken care of by the primary care physician. If labs are ordered, you give them instructions on where to go for their labs or x-rays, or you get them ready to see a specialist for specialized care. You mix the administrative, clinical, and laboratory duties. Some medical assistants work in the front office registering patients, some room patients taking vital signs and helping to prepare for procedures, and some take care of laboratory duties doing point-of-care testing and drawing blood. You are the link to the physician and the other licensed practitioners. You give them the information they need that the patient has given to you. Medical assisting organizations are professional associations. They set high standards for quality and performance and define tasks and functions. We call this the scope of practice. They're a great place to provide for networking, to getting to know other people in your field and in your area. We have accreditation agencies and we have other medical assisting organizations as well. The American Association of Medical Assistants, the AAMA, also known as the AAMA, is a national association that was founded in 1956. It's endorsed by the American Medical Association, and the purpose of the AAMA is it works to raise standards of medical assisting to a higher professional level. The AAMA is the only professional association devoted exclusively to the medical assisting profession. Accreditation of programs that teach medical assisting, done through the Medical Assisting Education Review Board, known as MERB. Continuing education is required to maintain your certification, and continuing education means that you need to attend seminars, do online reviews of articles, and take a quick quiz. You update your CPR every 2 years, and you get 1 CEU for every hour you spend on doing this. The American Medical Technologist, the AMT, began as a program to register medical assistants in the early 1970s, and it provides certifications such as Registered Medical Assistant and Certified Medical Assistant Specialist, and the benefits are similar to those offered by the AAMA. The National Health Career Association, known as the NHA, was established as information resource and network for health professionals. The National Center for Competency Training has no allegiance with any organization or association and does not provide certification. The National Association for Health Professionals, the American Medical Certification Association, and the American Registry of Medical Assistants do not provide certification. They are agencies that you can list your certifications with. The Medical Assistant Credentials. Certification is an organizational confirmation of qualifications to meet professional standards and established competencies of a medical assistant. Now, registration, it says, does not guarantee competence, but does grant certification to practice a chosen profession, not a license. And it also, you have to sit for a national board exam as well. State and federal regulations. The Occupational Safety and Health Administration, which was created by the federal government, is an administration to help protect the healthcare worker in the healthcare place, to make sure that everything you do is done in a safe manner. The Clinical Laboratory Improvement Amendment of 1988, known as the CLIA Amendment, was created so that healthcare professionals can perform point-of-care testing with the patient, such as doing a strep test in the office, or doing a urine pregnancy test in the office. The AAMA credential is the Certified Medical Assistant, the CMA, and the exam evaluates mastery of medical assisting competencies received at accredited schools. And this means that the school has been approved by the AAMA because it meets all the requirements of the AAMA, and so its graduates can sit for the CMA exam. You must recertify every 5 years, and every year you must earn 12 CEUs or continuing education units to remain active. The AMT credential is the Registered Medical Assistant. Instead of an accredited school, students can use experience in the profession as a basis for testing, as well as an accredited school. The CEUs needed for recertification every 3 years include knowledge of the Health Insurance Portability and Accountability Act, or HIPAA. Training programs. They are a knowledge base, and it should include administrative and clinical skills. You should have knowledge of insurance and the reimbursement cycle, the payment cycle to the office, compliance with healthcare rules and regulations, such as HIPAA and HITECH, exceptional customer service, practice management information, and current patient treatments and education should be included in your training program. Program accreditation is through the U.S. Department of Education. It recognizes 2 accreditation bodies, the Commission on Accreditation of Allied Health Education Programs, known as CAHEP, which works with Medical Assisting Educational Review Board, or MERB, and the Accrediting Bureau of Health Education Schools, known as ABHES. Work experience. What does work experience do for you? This practicum is required for graduation from an accredited program. We call it an externship. And the length varies depending on the program. Some programs are from 120 to 180 or 200 hours. Site preceptors become involved with instructions. You have someone you have to report to, and they will evaluate your performance through the externship. It is an unpaid experience. It provides a bridge from academics to the workplace. All the things you've learned in the classroom, both in writing and practice, you now take to the workplace and see how everything is applied. What is professional development? Professional development is the need to be prepared on day 1 for your first job. Are you ready to go? Additional training, known as cross-training, are other forms of education that lead to job placement. Volunteer programs are rewarding experiences, and you gain experience in the healthcare profession. It looks good on a resume. And interest gained for alternative healthcare setting. It's a pathway to being hired permanently. Multi-skilled healthcare professional is a cross-trained team member, such as a medical assistant who is also board certified in phlebotomy and/or EKG. You are a valuable member to the healthcare team. Cost effective. You are in high demand. You can expand career opportunities. However, your scope of practice cannot be exceeded. One example of scope of practice is this. You cannot give advice to patients on how to take care of themselves. That is outside of your scope of practice. You have to be a licensed practitioner to give advice and instruction. You can explain procedures as instructed by the practitioner, but you cannot give advice to patients. There is no single national definition, and the standard of care must be followed. Networking. What is networking? It's crucial to success in any career, and it builds alliances socially and professionally. And you can start networking now by attending professional association meetings. Once you become a member of the AAMA, the AMT, or the NHA, you can go to the regional meetings or chapter meetings every month, get to know people, and listen to the lectures that are given and earn CEUs. You participate in conferences and workshops, and it generates opportunities for employment. You may hear of jobs that are open. They usually ask anyone if they know of any job openings that they need. And you work on your professional growth at these networking events as well. And this ends today's lecture.